Hello, everyone. Welcome to RWD Academy. This is Iris. RWD is a life science company focused on animal health. We have been founded for more than 20 years. We have a veterinary anesthesia machine, ventilator, dental unit, laser therapy, and many other best-selling products in the world. So we started RWD Academy, hoping to provide more service and knowledge to our users. Now, please allow me to introduce today's theme and lecture. Today's theme and lecture is veterinary dentistry marketing. Spend more than 30 minutes online. You will receive our training certificate for this webinar. At the end of the webinar, we have the lottery, and the prize are dental instructions. You can look forward to it. At the same time, we also have a lesson knowledge test. If you complete, it will get an e-version certificate. We are so proud to have Dr. Brook Niemiec speak for these editions. Dr. Brook Niemiec is a 1994 graduate of the University of California, Davis School of Veterinary Medicine. He is a board-certified specialist in veterinary dentistry in both the American and European veterinary dental colleges, as well as a fellow in the Academy of Veterinary Dentistry. He's one of about 10 veterinarians in the academic veterinary dentistry worldwide to hold all three of these certificates. He is a past president of the AVD, as well as the AVDC delegate to the World Small Animal Veterinary Association. Is recognized internationally as one of the leading authorities in veterinary dentistry. Now let's warm welcome Dr. Brook Niemiec.
Hey,
Hi,
Jay.
Dr. Brook Niemiec. Nice to meet you. Yes, I can see you now.
You can, because I can't see myself. So it's going to be interesting. Maybe that's a good thing. So, okay. Hi, all. So I'm not sure which countries that I am talking to this evening. But when RWD asked me to do something about marketing, I thought this was a really good way to introduce it, mostly because the World Small Animal Veterinary Association is global, and you guys probably don't know everything that WSAVA can do for you. And so I thought that I would introduce marketing, but also by using my lecture that integrates the World Small Animal Veterinary Association's dental guidelines and how they can help you, because we as a association is bigger than me as a veterinary dentist. So what I'm going to do for the next hour-ish is to talk to you about how to get your clients to say yes. And we talk about marketing, but it's not necessarily so much marketing like, fancy photographs and, brochures and all that kind of stuff. Really, the basis of this lecture is to talk to you guys about how to communicate with your clients to improve their compliance with what you are recommending. So that's the overall arching idea of this lecture. And the big way that you're going to do that is through education. So educating your clients are going to increase your compliance with what you recommend. But the first thing you need to do is educate yourself, which is why I'm here tonight. And then also by using these guidelines, which are, by the way, free for you guys to use. So I'm going to talk to you about them and tell you where to get them, and how to use them. And then also just talk to you about how I talk to my clients and how I get them to do what I want them to do. So first of all, first question I have to ask, and usually I'm doing this live, so I ask for a show of hands, and it's always really interesting. So you out there, think about this. Are you a member of the World Small Animal Veterinary Association? What do you think? Are you? Well, to be honest, you may not know it, but you probably are. The World Small Animal Veterinary Association is an association of associations. So most associations, over 108 associations worldwide, are in WSAVA. over 200,000 veterinarians are members of WSAVA. And I'll tell you, 2/3 of them don't even know it, which is really sad. And so depending on what country you're in, there's a lot of stuff that you guys can take advantage of as a member of WSAVA. So I would find out if you are not a member of WSAVA, if your association is not, I would check and go, well, why aren't we? Because there's a lot of things, not just the dental guidelines, but so many things that are valuable. And I know that this particular lecture is set up for the Asian groups. Just so you know, next year, WSAVA in early September, so basically a year from right now, the World Small Animal Veterinary Association Congress is in China next year. So you might consider coming to that. It's really good. So you're entitled to all the information and toolkits that are available. It's a strong united voice. And the thing about it is a lot of the stuff on there is translated as well, which is helpful. So a lot of this information came out of my textbooks that I've written. I tell people all the time, I'm not that smart. I'm really not. I was very average in veterinary school. But the reason I know so much stuff is I write books and I write, articles and I lecture. So I have to know stuff real well. So the stuff from this lecture is going to come out of mostly these textbooks. International shipping is not cheap, but these two books, Veterinary Periodontology, if you're into gum disease, and this is the number1 book that I recommend. Anything that I've written is this one from it's actually currently CRC Press. You can order those off of any of your websites. It can be delivered international. Oh, by the way, down here in the corner is a little QR code. That's my Instagram. I do a lot of veterinary education on it. If you want to follow me, that's a link that will take you right to it. All right. Why is increasing dental clients in compliance important? Why is marketing your dental department important? Again, there's the how about dentistry. How do you do something? And the why. The why is I hate to do this, but it's the heart thing, right? Why do we want to do it? Because we want to take care of the animals. That's the big thing. We need these animals to feel better. And dentistry is so important when it comes to animals' oral and overall health. So why is taking care of your pet's mouth important? Because dental disease is by far, and I mean by far, the most common problem in veterinary medicine today. It's not even close for number 2. When I talk to people about the commonality of dental disease, I'm like, dental disease is number 1, number 2, number 3, number 4, and then maybe you get to skin disease and overweight and GI problems. Why? How do I know this? Brooke, you're just an egocentric veterinary dentist. No, not necessarily. When we look at this, 70% of cats and 80% of dogs have gum disease by 2 years of age. Do you want to know the sad truth about it? That is the study that we as veterinary dentists have been quoting for 30 to 40 years now, that 80% of dogs have gum disease by 2. And that's scary, that 80% of your patients have gum disease. The real sad thing is, with better diagnostics, with change in our demographic of patients to smaller dogs, current studies, 90% of dogs at 1 year of age have gum disease. Periodontal disease is not an old dog thing. It's a young dog thing. They all get it, especially little dogs, which we'll talk about. The problem is we as a profession treat these things like we treated them 40 years ago. Oh, 6 years old, let's do a cleaning. 4 years old, let's do a cleaning. For a big dog, maybe. For a poodle or a Yorkie or a Maltese or whatever, no, you got to start at a year. Why? Because one of the studies in this showed that 30% of dogs under 10 pounds or under 5 kilos had bone loss at 1. You got to start treating these dogs young. 10% of dogs have fractured teeth with direct pulp exposure. 50% of dogs have fractured teeth with indirect pulp exposure, which is painful. Up to 40% of cats have tooth resorption. The oral cavity is the 4th most common place to find cancer. Add to that stomatitis, orthodontic disease, enamel hypocalcification, whatever else you want to add. Literally, ladies and gentlemen, every pet, okay, 99.5% of the patients that walk into your practice every day have a dental problem, if not more than one, yet they don't show any clinical signs. And so they walk right out the door without any therapy. That's not good medicine. We have to do a better job of an oral exam. We have to do a better job of education. Okay, let's keep going. Hello. Cool. Okay. So why else is increasing your compliance important? Because oral disease hurts. They never show it, but they do hurt. And it also causes severe local effects, eye infection, eye loss from periodontal disease, mandibular fractures in little dogs, oral nasal fistulas. That's what I'm showing you all here. Eye loss. This dog lost his eye because of gum disease. That's his eye juice. That's vitreous humor pouring out of his face. Why? Gum disease. That's a dog whose jaw broke. Why? Gum disease. That's a dog that's got chronic nasal infection. Why? Gum disease. Abscesses, osteomyelitis, cancer. All these things are being caused by gum disease locally, but it also goes systemically. Fractured teeth that are infected, it allow the bacteria to go systemically. Periodontal disease allows the bacteria to go systemically. Now, this is somewhat controversial, but I believe in it. The heart, the kidney, the liver, the lungs, diabetes, arthritis. People with bad periodontal disease die earlier than people in good periodontal health. Why? Chronic inflammation. You've got to get these patients treated. Due to the significant amount of pain and infection, including the local, regional, and systemic consequences, the and undertreated dental disease decreases the pet's quality of life. It does. Oh, by the way, we'll talk about animal welfare in a minute. A study out of the UK showed that dental disease was the #1 animal welfare concern because of its commonality, its chronicity, and the level of disease. It is the #1 animal welfare concern. We need to treat it better. Okay? So why else is marketing important? That's why you want to take care of your pets. That's why we went to vet school, right? But why else? Well, heck, we got a practice to run. We got to pay for our staff. We got to pay for the blood work. We got to pay for the new x-ray, right? So unfortunately, at least in the States, we've lost a lot of these traditional revenue streams. I was a general practitioner in the early 90s. Early to mid 90s, I was a GP before I went into dentistry. Every animal got an annual vaccine. Every, DHLP, parvo, rabies, leprosy, leptospirosis, all of them every year. Flea control, heartworm, medications, prescription diets, all of those every single year. Here's the problem. Many of those have now gone online, and vaccines are every 3 years in most cases. The flea control bought online. So a problem is these easy money is going away. Not only is the internet directly taking money from you by prescription fees, whatever internet you have, at Amazon, Alibaba, Chewy, whatever the clients use, that's money coming out of your pocket. But not only that, you don't need to be a veterinarian to have a website that recommends care for pets. I can't tell you how many of my clients will go, oh, well, I ordered on the internet, I ordered this junk off the internet. So they may or may not be reliable. Some of them are, and they're helpful. Mine is, obviously, but they're not always good, okay? So the problem is with the internet, even though it's great, I can buy a ticket over to Thailand right now if I want, on the internet, save me some money, or I can buy concert tickets or whatever rather than sitting on hold. It is great. But the problem is, number one, it's a direct loss of prescription fees. You're going to lose, depending on your country, prescription fees because clients are going to order the drugs offline, and less client visits because they're going to go to Dr. Google and figure out what's going on with their pet rather than coming to you. So how do you compete with that? You do things that only you can do. You cannot order up an extraction on the internet. That they have to come to you for dental work. They're not going to go on Amazon or Alibaba and put I would like a dental extraction, and a drone's going to come over here and extract the dog's teeth. Yet. It might happen in 20 years, but at least right now, we're the only ones that can do that. It can't be ordered on the internet. So when I talk to veterinarians and I talk to other people, and yeah, I will have any of the Q&As I'll do at the end of the lecture. So when you talk about marketing, it's always best to market to your veterinarian or to your clients the things that only you can do. So why were the guidelines important? So again, we're going to talk a little bit about the guidelines. We're going to talk also about how important education is. Why are the guidelines? Why am I speaking to you tonight? Because there's a tremendous lack of dental education in the veterinary curriculum worldwide. In the United States, in the developed countries, only 1 out of 5 vet schools have a veterinary dentist on staff, meaning the rest of it is being taught by GPs or not at all, even less elsewhere. And there's minimal CE provided. It's changing. We've changed WSAVA's, view on it, but in all of WSAVA CE, there was only 1 scheduled in all of 2020 for dentistry. So the problem is, because we're not getting taught in vet school, and because CE is so poor, what's happening is that we are learning from people that graduated 30 years ago, and they didn't get any dentistry either. So this allows these myths and misconceptions regarding dentistry to continue, which results in dental disease being undertreated, poorly treated, or not treated at all. The misinformation allows procedures such as anesthesia-free dentistry to flourish. Antibiotics are way overused. There's no areas of veterinary dentistry that need to be standardized more. So what are the guidelines? Why do I like them? Well, it's a document outlining the minimum standards of care written by a bunch of veterinary dentists. They inventory the myths surrounding it. They are evidence-based medicine for the most common problems: gum disease, fractured teeth, tooth resorption, oral cancer. And it's a very standardized way of doing charting, doing exams, because what I find is that there's so many people that teach so many different ways on how to do a charting, and it's kind of like having all the different languages out there. You can't understand each other. So it's one united voice. It's also ideal, as well as minimal equipment and procedure list. This is done in a 3-tiered format. And I know it's common for people in developing countries to go, well, yeah, it's great for you in America to be able to do this, or it's great for people in England to do this, but it doesn't work here. Well, using the World Bank's socioeconomic tiers, they created it where you can be on the level playing field with everybody else in your country. The goal is to improve standards of veterinary dental care worldwide. So what else is it? It's easily obtainable, free CE. It's all web-based, and it's translated into, I don't know, I want to say 10 to 12 languages now. So take a look. It might be in your language. And what are the guidelines at its core? It's a 100-page mini textbook on gum disease. And also we supply client educational information. So who's on the committee? Diplomats from North America, South America, Europe, Africa, Australia. There's someone in the university. But we all know that you can't do dentistry without anesthesia, so we brought an anesthesiologist on. We know that nutrition plays a big role in gum disease. And what we have found, I've already alluded to this, that welfare is a big part of dentistry. So this is our team. This is me, obviously. We've got a bunch of dentists from all over the world, a nutritionist, a great anesthesiologist, and then a couple welfare scientists. Okay, so how do we do this? Now I'm going to get everyone's ears perked up. Yeah, that great, Brooke. That's all raw and cool. What do I do? How do I make money? Well, here we go. How do you increase dental revenue? It's a 4-pronged attack, depending on what you guys want to look at and accomplish. So you can do one of these. You can do all 4 of them. The nice thing is they're synergistic. If you do 1 and 2, they're going to go up. So number 1, and the most important, do more dental procedures. How do you do that? We'll talk about it. Number 2, get more income, do more procedures per dental. Number 3, improve your preoperative testing. And number 4, improve your postoperative care. Okay. So here's the most important slide of this entire lecture by far. Everyone wake up. Okay. I know it's early wherever you guys are, late here. How do you do more dentistries? How do you get clients to say yes and get that patient from your exam room to your operatory? Client education. End of story. Those 2 words are the most important words of this entire lecture. Why? Because when those patients come in with gum disease, your clients are going to look at him and go, why do I need to treat it? He's eating, right? The problem is that that animal's in infection and he's in pain, and you need to treat him. But the problem is your client's gonna go, but he doesn't act like he's in pain. I know, they don't show it. So you've got to educate them. You've got to tell them about all the systemic and local problems, like we already talked about, we'll talk about again. You've got to tell them it's more than bad breath and tooth loss. And it's got to come from your entire staff. Everyone that's on this call right now, you should be going back to your practice tomorrow, and you should be educating your staff as to how important dentistry is, how to talk to them about dentistry, because if the doctor goes in there and recommends something, but the technician or the CSR goes in there and goes, it's not that important, you're never going to get the client. So when it comes to client education, you need to spend, 5-10 minutes talking to them about gum disease. Okay. So, or whatever the animal's going on. So that's the beautiful thing about, the guidelines, is that it has everything on here, and you can read about it, or you can even hand it to the client and go, read about this. This isn't me telling you this broken tooth needs to be treated because I want your money. That's what the clients think. It's the World Small Veterinary Association doing it, but you have to educate your client. So what you need to talk about is how these things are painful, how these things are infected, why they need to treat it, what's the therapy for traumatic malocclusion, all that kind of stuff. Everything's in there, and you got to talk about that. What are other sources for client education so you don't have to sit there and blather on for a half an hour about gum disease? Send them to websites. We have a website. This is mine, actually. It's Vdspets. Now I need to change this, but it'll still go there. We have client educational videos on everything. Periodontal disease, fractured teeth, fractured jaws, stomatitis, cancer. And clients, it's in English, but it's the way that I educate my clients on how to take care of their teeth. Posters and books. I mean, clients are visual animals. That's the old saying. Pictures are worth 1,000 words. It really educate your clients. So you can put together a poster. This is a poster that we have through our vet dental training center, or a book. And this is that oral pathology book I talked to you about at the beginning. It's got great pictures and x-rays that talk the clients through exactly. I show this book to clients. It's like, hey, it's not me telling you need to do it. This book is saying to do it as well. So the other thing is to get training. I tell people all the time, you cannot win a Formula One race without driver's training. You've got to get some training. So number one is going to improve your ability. So tonight I'm giving you some ability to sell dentistry. Getting your other practitioners to come to these things as well will be helpful. But if you learn how to do your procedures better, you are going to be faster at them. You can't drive a car unless you've had training. You can't use an elevator unless you've had a training. You can't clean teeth unless you've had training. So the problem is that none of us get training, and we just kind of, ham fist or, muddle our way through doing dentistry, whether it's a cleaning or an extraction. It takes a long time. The investment in getting some hands-on training is invaluable, because not only does it make your procedure faster, it's better for you because you can make some more money because you're more efficient. It's better for your patient because it's under anesthesia less, but it's also, you're going to have less complications. I cannot stress proper education better. It's worth its weight in gold. So it benefits everyone. I already talked about this: shorter anesthesia for the patient, less surgical trauma, less post-surgical complications for the client, less stress for the veterinarian, increased income for the veterinarian, and less stress on your staff. The other way that you can improve your efficiency and do more cases is better equipment. Here's the thing. Veterinarians worldwide are cheap. They are. And we'd say frugal, but it's not true. They're cheap. And so the problem is that now you've done the marketing. You've talked to your clients. You've got them, interested in doing more dentistry. And then you're booked out for 6 months and you want to go faster. The problem is, without training and without equipment, you can't. So if you're trying to do dentistry with old, dull instruments, it's not going to go faster. And so the thing that I say, if you can do an extra case a day, you're going to pay off some good new equipment. So what do we recommend? Well, a good high-speed drill system is critical. I mean, you absolutely have to have a high-speed drill system for extractions. You do. You have to section teeth. You have to take bone away on occasion. You have to have it. Good ultrasonic scalers, slow speeds for polishing. The investment in a good high-speed drill system is going to pay itself off in months. And then it's just all making money from there. I cannot stress how critical x-rays are. Really, in most countries, it's considered standard of care. If you guys don't have dental x-rays, if there was one piece of equipment that will generate more income for practice, it's not an ultrasound. It's not an endoscope. It's not anything like that. It's dental x-ray. Number one, it's going to speed your extractions by orders of magnitude because you're going to know about root pathology. Number two, it's going to make it better. And, just going to overall make your treatments better, but it's also going to find a lot of pathology that then you get to treat and then you get to charge for. There is not one piece of equipment that you can put in your practice that will make more money than a dental x-ray. It's plain and simple. You got to have it. End of story. Okay. Burrs. Okay. Now you got your high speed, or you have one and you're using this burr, and veterinarians tend to use them till they're rusted and dull. They should be a hot knife through butter. It's an American saying. It should be a zzz and cut. If it's not cutting fast, throw it away, put a new one on. I don't know what it costs in other various countries, but in America, they're like $1 a piece. They really only last for 10 seconds before they start dulling. And after about a minute of use, like on a tooth or bone, they're pretty worthless. I tend to go through 2 or 3 if I'm doing full mouth extractions. I really do. So please, do not use old burrs because they're just going to dull and it's going to waste your time, which, right? Time is money. But not only is it wasting time, it's overheating the patient normally, which is damaging them, but it's also damaging your high-speed handpiece and your turbine. Every second it's running, every second that compressor is running, it's a mile on its odometer or kilometer on its odometer, or whatever it is. You're damaging $7,000-8,000 worth of equipment to save a $1 burr. It makes no sense. Use new burrs. Ultrasonic scalers, they're pounding on that tooth 30 to 40,000 times a second. They're getting worn down over time. When you lose 1 millimeter off the tip of that ultrasonic instrument, you've lost 25% of your cleaning ability. When 2 millimeters are gone, you've lost 50% of your cleaning ability. What does that mean? It's going to take you half again as long to clean the teeth with a 2 millimeters being gone than as opposed to a new one. So what do I recommend? You buy a new one, you measure them. When 2 millimeters are worn off of your old one, throw it away, put a new one on. You're going to cut your cleaning times by 1/3 at least, maybe half. So you can do an extra one a day. These are about $100 each, okay? Anything new, luxating elevators, curettes, scalers, anything, you've got to take care of your hand instruments. If you're not sharpening your hand instruments daily or weekly at least, they're getting dull. If you haven't sharpened them for years, they're probably worthless. And I would probably invest in some new ones, some good luxating elevators, some good curettes, and then teach your staff how to keep it sharp and keep them sharp. And again, if you guys are going into surgery, you don't want to use a scalpel blade that's been used 10 times. You're going to use a new one. So then why do we use old stuff in dentistry? Because we're cheap and it's just dentistry. Stop. Dentistry is important as surgery is. Use new blades, sharpen your instruments, take care of your patients. So again, the guidelines, going back to that, they have minimum standards. If you guys want to look online, it'll tell you everything that needs to be done within your particular country. So that is how we do more dentistries. I tell people all the time, it's not rocket science. We do more dentistries by educating ourselves so that we can educate our clients to get more clients saying yes. Then we get a whole people saying yes and wanting to do the dentistry. So we want to do more dentistry, but we can't rush through it. We have to be more efficient. So how do we do that? We get training so we know what we're doing. We get better equipment so it's faster. And we basically take care of that equipment. That's it. It's not rocket science. That's all you do. So now we want to further increase it. How do we further increase our dental revenue? Well, if you're already getting the maximum amount of dentistries per day, the only way to increase from there is to improve the transaction each one. So how do you do that? Well, I already told you this. Number one, dental radiology, by far and away. That's the number one. Number two would be treating periodontal pockets, 3, 4, 5 millimeter periodontal pockets, and using periosutic. Nerve blocks. If you guys aren't doing regional anesthesia, learn how to do them, start doing them, and charge for them. Bonded sealants we'll talk about in a second. Fluoride therapy, not advanced procedures. You don't have to do. I tell people all the time, do the basics well. Okay. How else? Improve patient care. Okay. Again, your clients' pushbacks to dentistry are twofold. Number one, fear of anesthesia, right? Fear of death under anesthesia, and cost. So what you need to do is you need to talk to your clients about the fact that we take better care of the average patient. We do a really good job. This is all the expense that we go through to make sure your baby's okay. Okay. And this is what it costs. So temperature maintenance is important. Circulating water blankets, warm air blankets, fluid monitoring is a huge thing. And you have to tell your client, yeah, we monitor all these parameters. Same thing with preoperative testing. Not only does preoperative testing directly increase your fee, your amount of income, but it also decreases your client anesthesia concerns. I talk to clients all the time. There are 4 things that need to be working for your dog to do well under anesthesia: heart, lung, liver, kidney. Those 4 things are doing well, and you shouldn't be anemic. Those 4 things going well, I don't have any concerns about anesthesia. So run a complete blood panel. If you run a complete blood panel, you're going to find stuff. Other things, I do like chest x-rays in my older patients, and we've started to run a cardiac, what's called a cardiopet, at least here in the States. It's an IDEX product. Not sure if you guys have it, but I really, really like it. And again, work them up. It's good. It's direct money, but it also keeps them safer under anesthesia, and it decreases your client's concern. Okay, so that's the overall marketing plan. I'm going to spend the rest of this lecture talking about specific areas of veterinary dentistry that you should know about, but you may not, and how to convince your client to do it. So like I said, fractured teeth, 10% of dogs have a fractured tooth with direct pulp exposure. All teeth with direct pulp exposure are either excruciatingly painful, horrifically infected, or both. And there's only 2 options for therapy for direct pulp exposure, and that's root canal or extraction. Watching it is not one, and waiting for it to abscess is not one. So there it is. Here's a fractured tooth. There's the nerve. This dog is in agony, and it needs to be treated now. Oh, by the way, when this dog comes to see you on a Saturday afternoon and you do a physical and you find it and you can't do the surgery that afternoon and you're going to schedule it next week, this dog, critical point, ladies and gentlemen, this dog does not, understand, not need antibiotics. There is no indication for antibiotics for this patient. End of story. He needs pain management. He's in agony. This dog needs a non-steroidal. This dog needs gabapentin, something for his unrelenting pain. And yes, I know he's not showing it, but he's feeling it. Okay. That's a complicated crown fracture. An uncomplicated crown fracture is what you guys may not know about. This is incredibly common in large breed dogs. And this is where the crown is broken off, exposing the dentin, but not exposing the pulp. So this is the enamel, the pearly whites, this very white, shiny stuff here. That's the enamel. This is the dentin. So the dentin gets stained because it's porous, and it has millions of dentinal tubules running in from the root canal out to the periphery where it's covered over by the enamel. So from this standpoint, this dog hurts. It's like having a deep cavity. I'm sure if you guys think about it, you see this every day. Every big dumb dog chews on something too hard and breaks their teeth. They need to be treated. How do you treat an uncomplicated crown fracture? Depends on the dental x-rays, okay? If you take a dental x-ray and it's normal, okay, so there's no signs of periapical disease there, and it looks like this, you can't get into there, I recommend what's called a bonded sealant. A bonded sealant is basically a layer of epoxy that you smooth out the tooth. You put this epoxy, basically, it's very similar to clear nail polish, put it on the tooth. What that does is it blocks off the pathway for sensitivity, blocks off the pathway for infection. It smooths out the tooth to decrease gum disease. It works really well. You guys can, this is a kit that I put together. You can buy the components anywhere in the world. It's not that big of a deal. We do sell a book that has a step-by-step on it. I think that every veterinary practice should be offering this. It costs about $500 to get into, and it'll treat a bunch of teeth. Okay, so I do believe that. If you guys want more information on that, send me an email or a text or something like that. But this is the same dog, same tooth, opposite side. Looks the same, right? There's the x-ray. See the periapical lucencies here? This tooth right here, okay, it's not pulp exposed, but it's broken. The infection got in through the dentinal tubules. This tooth is dead and infected. If you're going to treat this, again, that goes back to root canal or extraction. Okay. All right, periodontal disease is what we're going to end up with. Why? Because it's the most important problem in veterinary medicine. It's the #1 problem. More than skin, more than ears, more than our weight, more than healthy. We've already talked about it. 90% of the dogs walking into your practice have gum disease. They all need to be treated. This is what you want your animal's mouths to look like. This is what you want your mouth to look like. There's no plaque. There's no calculus. There's no redness. This is completely normal. Problem is, it took me 2 years to find this dog to put him in this lecture. Why? Because he doesn't exist in nature. They're all infected. We've got to do a better job of keeping them like this. And we also need to keep the bone up here where we want it to be. Okay. So the cause of gum disease is a product called plaque. What's plaque? Plaque is a biofilm. What's a biofilm? A biofilm is a layer of bacteria on a surface, and it can be anywhere. There's a bacteria on the cup I'm drinking out of. There's a bacteria on the keyboard that I'm working on. There's a bacteria biofilm on your hand. They're normal. They're everywhere. The problem is when they're allowed to build up, like on the teeth, it becomes infected. 300 million bacteria per gram. They ultracentrifuged plaque to get more bacteria into it. They couldn't. It's all bacteria. So if you guys got up this morning, you scraped your teeth like this, you got that white creamy stuff on your fingernails, or if you flossed your teeth last night and you got that cream cheese on your floss, do you know what that is? It's bacteria. That's all it is. Okay. Eventually it'll get calcified by the minerals in saliva to become calculus or tartar. But here's the big thing. Plaque forms on teeth in 24 hours. Tomorrow, you guys, or today, I guess, you're going to do the most beautiful job cleaning these animals' teeth. The next day, they're coated in plaque. In 3 days, tartar's forming. And in just 2 weeks, gingivitis is starting again. What does that mean? You've got to do home care. We'll talk about that. So supragingival plaque. This is the stuff that you can see on the surface of the teeth above the gum line. It can get really thick. But remember this. Everything that you can see on the surface of the tooth does nothing to your patient. I don't put this slide in here to gross you out. I don't put it in to show you the pus, the hair, all this stuff. I put this slide in to tell you that all of these trillions of bacteria on the surface of the tooth does nothing to the patient. It's the stuff up underneath the gum. When the plaque gets up underneath the gum, it starts creating inflammation because it changes from aerobic to anaerobic, okay? So gingivitis and periodontal disease are caused by subgingival plaque, not supragingival plaque, okay? You've got to clean at and below the gum line. Also, we were all taught, flip the lip, look for tartar. Flip the lip and look for tartar. It's not tartar. Tartar is ugly, but it's not the cause of disease. Plaque is. Oh, by the way, tartar, if it's down below the gum, if you scrape the plaque off the tartar, the gums will heal to the tartar, okay? So if you look at this dog, and we were all taught to look for the level of tartar to determine if the dog needs a teeth cleaning. This dog has no tartar, but horrific inflammation. This dog desperately needs its teeth cleaned. But if you were looking for tartar, you wouldn't treat it, okay? Vice versa, we look at this cat. He's got this huge iceberg of tartar running down his cheek. But you don't even see any gingivitis. This cat's got no inflammation. Does this cat need a cleaning? Sure he does, but not near as bad as this dog is. So clean animals' teeth more commonly. So what does periodontal disease do? Well, the first thing it causes is gingivitis. Gingivitis is inflammation only to the gingiva. So we don't have any bone loss yet. We don't have a recession. We don't have any pockets. But what do we got? Well, redness and swelling to the gums, plaque and calculus on the teeth, increased bleeding on probing, and bad breath. Let's take a look at that. Redness, swelling, bleeding, bad smell. What's that a sign of? Infection. This dog is infected. This dog is dying a little bit every day because of the gum disease. The problem is the vast majority of veterinarians would go, it's not that bad. Let's wait till February. We're having a special, right? That's National Pet Dental Health Month here in the States. No, you've got to treat this today. Because if you don't treat this today, what's going to happen? It's going to get worse, right? And then we might end up with an extraction. Well, that's silly. Why didn't we just prevent it? Because we look at this. This is the example that my ex-girlfriend actually and I came up with. This dog cut his paw pad at the park. He came in. He's limping a little bit, but is he dying from this? No. Are you going to go, you know what? March is our lacerated paw month. No, because you know if you don't treat it, it's probably going to get infected. Then it's going to end up like this. Now we have to amputate these legs because we didn't treat this. Well, if we don't treat this, we're going to have to extract the tooth eventually, which in my opinion is an amputation. Oh, Dr. Niemiec, you're silly. How can you relate an amputation to an extraction? Easy. What's a dog's hands? His mouth. And if a dog's hands are his mouth, then what are his fingers? His teeth, specifically his canines. It's all preventable. Treat gum disease. Please, 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 please. So another thing we were taught about gum disease, which is wrong, is that the first sign of gingivitis is redness of the gums. No, it's not. The first sign of gingivitis is bleeding upon probing or brushing. If you've ever flossed your teeth or brushed your teeth, you've got blood on that floss or that brush, you have gum disease. You do. Okay. So here's a dog. His teeth look great, right? Externally. Why? Because the oral exam is not good enough to find disease, because if you had him under anesthesia, you would see the tartar on the inside. And it's been proven, and if you guys are interested, I can give you the study, that periodontal disease, the conscious exam is ineffective at finding the early stages of gum disease. You have to get them under anesthesia. But in the 80s, with an awake exam, you would say, oh, not a big deal, until you probe him. Look at all that blood. This dog has got horrific gingivitis and periodontal pockets, and you never would have known it. That is why, in my opinion, and most veterinary dentists' opinion, you need to clean the teeth every year, regardless. I don't care what the mouth looks like. You always find stuff. It needs to be treated. So if you don't treat the gum disease, the gingivitis, because it's not bad enough, because it's not February, or because there's not a lump that needs to be removed, now you're going to allow it to proceed into advanced periodontal disease. Now you're going to get bone loss. And it's either going to be via gingival recession, where you see the gums recede, or periodontal pocket formation, which you can't see until you probe. I tell people all the time, periodontal disease is 100% preventable. It's 0% treatable. So once the bone's gone, it's gone in most cases. So now we got some recession. I mean, we can work with this. We can clean this up. You know, this is about a 4 or 5 millimeter pocket, but we can clean that up. We have to do a little bit more work. We have to do some closed root planing. That's some tartar there that we have to clean up. But this, unfortunately, is not where our patients come and see me. This is. Now it's too late. These are hopeless teeth. We got all this pus coming out. We take an x-ray, all the bone's gone. We could have prevented this, but now we have to extract it. There are no other options there. But the problem is most veterinarians just talk about bad breath and tooth loss. That's what your client's perception is about periodontal disease. But it's far, far worse than that. These are all the local effects. I already talked to you about some of them, but you need to talk to your clients about it. Eye loss, pathologic fractures, nasal fistulas, abscesses, increased incidence of oral cancer. And then you also need to talk to them about the systemic effects. The #1 risk factor for kidney disease in cats is dental disease, cardiovascular disease, hepatic disease, canine cognitive dysfunction, chronic obstructive pulmonary disease. All these things are related in humans and animals. In humans, also diabetes mellitus and death. People die earlier. You've got to treat gum disease. It's called the silent killer. Okay. So people always freak out about anesthesia. But here's the thing. If you have a dog that's got heart, lung, liver, kidney disease, and you treat their bad infected mouth, their heart, lung, liver, kidney disease gets better. So what I tell people all the time, when an animal gets a little bit sick, don't stop treating the teeth. That way, when they get really sick, you don't have to treat the teeth. Okay. So really quick, how do we treat gum disease? Plaque control. If you have no plaque, you have no disease. It's a 4-pronged attack, depending on the level of disease. The first step is always a cleaning. Okay. And I'll talk about that. Periodontal surgery is when you get into pockets, home care, and then extraction is the cure. You've got to do dentistry under general anesthesia. You cannot do it awake. It's a complete waste of time. Please do not ever do this. It's a waste and it's bad for the patients. You can break their jaw. You just can't clean up underneath the gum. So how do the benefits guidelines benefit you? Anesthesia. Specific anesthesia for veterinary dentistry. Not only systemic anesthesia, but regional analgesia. We talk about all this with videos about how to do nerve blocks. And it's a step-by-step instruction on how to do ultrasonic scaling, hand scaling, polishing, and all that kind of stuff. Radiographs are critical. I've talked to you guys about this several times. You should be taking full mouth x-rays. The guidelines have that in there as well, how to interpret dental radiographs. And step-by-step on how to clean teeth. Home care, critical part of periodontal therapy. Why? I already talked about this. Plaque forms in 24 hours, calculus starts in 3 days, gingivitis in 2 weeks. The pockets are the same depth in 6 weeks. So basically, you clean the teeth today, in 6 weeks, it's like you didn't do anything, okay? So, and then extraction is the cure. Okay, everything else is maintenance. Extraction is the cure. And I tell people all the time, the tooth is the root of all evil. If you get rid of that tooth is cured. Everything else is maintenance. Again, in the dental guidelines, step-by-step instructions on how to do extractions, whether it's non-surgical or close, or making a flap and taking bone away. Getting towards the end of the lecture, I'm sure you guys have some questions, but how do we market the people? And this is a huge thing. This is actually, to me as a veterinary dentist, the most important thing that I have done in my entire career is these guidelines. And I remember when we were trying, the dental group, the people that were passionate about dentistry, were trying to get the executive board of WSAVA to say yes, to sign off on us doing these guidelines. We were talking. And I ended up in Canada with the president of WSAVA at the time. And he's like, well, Brooke, why do you want to do this silly dentistry thing? I mean, they eat and yeah, blah, blah, blah. And I kind of went through everything. I went in this lecture with you. And he looked at me and he said, Brooke, what you're telling me is that and undertreated dental disease is an animal welfare concern. I said, you're absolutely right, Walt. It is. So that's why we got the welfare people on board. The amount of information that's out there about animal welfare and dental disease is huge. So dental pain is real, needs to be treated. And undertreated dental issues cause daily unrelenting pain, infection, or both. You guys have all had, most of you have had dental pain. It hurts like hell. It causes stress and infection. It changes behavior all the time. It may be subtle. Your clients may not even know. But how often do we hear, I've got a puppy again, right? I wish clients I had a crystal ball to show clients what their pet will look like. So they deserve to be treated. Also, don't forget about humane handling. I mean, don't cause stress. Don't do non-anesthesia, all that kind of stuff. So other things that you benefit from directly and indirectly, you've got toolkits. We've got toolkits on brushing with videos on how to brush animals' teeth, on oral cancer, all these different things. They're free, they're non-commercial, they put them up, they're client educational stuff that goes out there. Other things that we have, if you guys are wanting to give a lecture or wanting to educate your clients, we had some really high-end drawings of anatomic areas in the mouth. If you guys want to use the skulls or stuff, they're all free. You can all use them all online. So in conclusion, and I'll take any questions you guys have in the last little bit that we have. There are incredibly number of conditions with great oral pain, infection, or both. Gum disease, fractured teeth, tooth resorption, non-vital or dead teeth, malocclusions causing trauma, oral cancer, stomatitis. Honestly, ladies and gentlemen, every pet that walks into your practice or is carried or comes in a little stroller, right? Those little poodles, they all have a dental problem, at least one. Many of them have more than one. They all need to be treated. Treating dental disease increases their overall health. It increases their quality of life. And it may just increase their quantity of life. Every pet has the right to a pain and infection-free oral cavity. So help us out. Start training if you guys want training. I know this is mostly in Asia, it's a long ways to go, but I do have hands-on training in San Diego. March is going to be the big one. We also have virtual wet labs. Again, that's my Instagram. Vdspets.com is my website. If you guys want to learn virtually, we have that as well as far as hands-on stuff. So I'm going to cruise up here to this Q&A and see what's questions. So question, how often should we sharpen periostal elevators and what tools? Really, how often you should sharpen them depends on how often you use them. If you're using them daily, I generally think, in general, weekly is pretty good. You know, some people do daily. I think weekly is pretty good. As far as sharpening, I use what's called an India stone or an Arkansas stone. Either one. I mean, Arkansas stone is probably the one that is the best, most standard one we use, with a little bit of sharpening oil and an Arkansas stone. Honestly, I'm not sure where in the world you are, but most distributors are going to carry sharpening instruments. If you're having problems getting stuff when you, you know, through your veterinary supplier, especially when you're trying to get veterinary, you know, dental specific stuff from a veterinary supplier can be really difficult. You may have to try and get it through a dental supplier, a human dental supplier. They're going to have all of this stuff. So an Arkansas stone and an Arkansas stone and sharpening oil is really all you need to sharpen. And ideally you would do it once a week. How do you minimize plaque formation? Well, the number one way, in my opinion, to decrease plaque is brushing. Toothbrushing, just like you and I, is going to be the best. There are a lot of treats. There's lots of diets. There's lots of other products that are out there. Some of them are great. Some of them are worthless. Things that I like, if it's available in your country, I like TD Diet from Hills. I really like TD Diet from Hills. I like the BI Dental Hygiene Chews. I like the Veerback Rawhides and Veggie Dents if they're available. I do like greenies. I think they work. I like Rawhides. I think they work. Plaque Off's another product. I think that works pretty well. I'll be honest, in my professional opinion, I have to say that from a legal standpoint, I'm not a big believer in water additives. I know some of them have studies that show they work. Not a big believer. I'm not a big believer in most dog foods. Again, in my professional opinion, I don't think they're great. That's why I like TD. But that's all those combinations are how, and then clean them at home. What dental equipment do you need to get started? Oh boy, that's a whole long list. Really, what you need, number one, you need a good ultrasonic scaler and polisher unit. You really should have a high-speed drill system, because that's going to section teeth and you're going to be able to take bone away if you need to. Dental x-rays, I mean, like I said, are critical. I personally like luxating elevators, but some kind of elevators, extraction forceps. My personal favorite surgery equipment for making flaps in dogs and cats is what's called a Molt, M-O-L-T, Molt 2.4. It's 2 millimeters on one side, 4 millimeters on the other. And, you know, good needle holders and thumb forceps are important. I recommend being able to do bonded sealant, but that may be the next step. But but and a good and some a scaler and several curads. That's about it. That's about all you need. And RWD, I'm sure, has all of that. What precautions should be taken during a cat's cleaning? I'm not sure what the question is. I specifically on that. I don't treat cats really any differently than I treat dogs. Basically you have to have a well-cuffed endotracheal tube. You have to use the correct type of ultrasonic scaler, at least as far as the strength of it. You should usually turn it down, but really cats and dogs are pretty similar. There's no specific things that we need to do. Yeah, I know. I get this question all the time. It's about anesthesia. I know you guys deal with these clients that are afraid of anesthesia, and trust me, I still do as well. How do I deal with it? Well, I tell clients that dentistry, like life, is a risk-benefit ratio. There's a risk in everything you do. There's a risk getting out of bed in the morning. There is. I mean, here's the craziest thing, and this is where I really, tell it to my clients, and they get it. What is the number one way people die? It's the number one cause of death in the world. Car accidents, other than heart attacks, but car accidents. We get in a car every day and drive. Yet we know that people die in car accidents every day. But the benefit of getting to work, the benefit of going to a concert, benefit of going on a date, that outweighs the minor risk of dying in a car accident. The benefit of a healthy mouth far outweighs the risk of anesthetic death, which unfortunately, even here in America, people are afraid because they hear everyone knows somebody whose dog died under anesthesia. This is where the only real way to combat this is to talk about how you do dentistry, how you do anesthesia, what you do in your practice. Hopefully it's really well monitored. Hopefully you keep them warm. Hopefully you run preoperative testing. All of these things decrease our morbidity and mortality, and they should do fine. So again, you have to talk about the fact that this gum disease hurts. This gum disease is infection that's negatively affecting their patient and can be killing them. There is a minor risk with anesthesia, but if you don't treat it, it's going to be painful and infected every day. I'm telling him, and the other way you can put it is like, if you have, people that get knee replacements and hip replacements are incredibly risky surgeries, clots and all sorts of stuff, and severe pain happen with hip replacements and knee replacements. Yet it's done hundreds, if not thousands of times every day. Do people die after it? Absolutely they do. Do people die during it? Absolutely they do. Do people have complications? Absolutely. Do they get it done? Absolutely. Why? Because they hurt. If your animals could talk, they could tell you how much infection they're in, how much pain they're in. Please take care of our teeth. Okay. Those are all the questions that I have there. I'm going to the chat thing.
Okay.
Okay.
Thanks to Dr. Brook Niemiec